the challenge, the opportunity to connect. The 1960s, a time of imagination and change, a time of anger and fear. The 1960s, a program called Challenge.
Good evening, ladies and gentlemen.
Looked at our connections, our divisions, through the lens of faith. Nearly 60 years later, during these challenging times, we'll take a new look at our divisions, our connections, in a new program called Challenge 2.0. Teen suicides increased 29%, just 1 month after the premiere of a Netflix program dramatizing that issue. Now, it seemed to support criticism by psychiatrists, who asserted the program 13 Reasons Why romanticized suicide and could lead to copycat behavior. The study, published in the Journal of the American Academy of Child and Adolescent Psychiatry, cited no evidence of direct causation, but it clearly illustrates this tragic issue has become all too real for all too many communities and families. That, then, is the subject of this edition of Challenge 2.0, Lost Treasures, Confronting Youth Suicide and Stress. So we are very fortunate to have three very special guests with a lot of wisdom and a lot of dedication toward addressing the problems that we're going to be talking about today. I'd like to introduce Elsie Dennis. Thank you so much for being with us, Elsie. You've become very active in advocating for more attention, resources, and aid to counter the pressures that all too often have led to youth suicide. And as a member of the Shuswap Nation, thank you so much again for coming with us. Reverend Rachel Tabor Hamilton, we're so glad that you've come back, been on some of our programs before, pastor of Trinity Episcopal Church in Everett, and is trained in critical incident stress management. We'll learn more about that. You've ministered to people in a variety of stressful situations, including after a suicide for people that were in the area. And Ace Bulger, whose professional experience includes being a secondary school coach, principal, and now works with what's called the Washington Healthcare Authority. And I suspect you'll explain to us more about what you do there. And I would just say again, thank you to each of you for joining us today. In our introduction, we highlighted the controversy generated by a single program that aired on one cable network. We won't explore whether or not it was in fact responsible for an uptick in youth suicides, but looking at the larger picture, are youth suicides, in fact, increasing? What data have you seen that indicates one way or the other?
Well, we know from the Center for Disease Control statistics that from 2001 to 2017, there was a 31% increase in suicides in our country. Mm-hmm. And then globally, I think that we've heard statistics that there's like 1 million people globally per year that are committing suicide. So unfortunately, everything that we're trying to do for intervention is really an uphill battle.
And you have some statistics on that as well, Ace.
Yes. One thing is that we have the Healthy Youth Survey for the state of Washington, and it breaks it down by 8th grade, 10th grade, 12th grade students. And the suicidal ideation and depression is increasing over a period of time. Depends on where you go in terms of finding your statistics on suicide itself. The bottom line to it would be that there's an increase in suicide among young people, for sure. Hopefully we're stemming that momentum, but the fact is that, yeah, we are still seeing an increase in suicide.
One of the things that shocked me as I was trying to prepare for this program is, in fact, not only is there an increase in terms of numbers, but a change in terms of the age groups. And there are children that are dying from suicide. Is that not correct? I mean, I saw 5 years of age was one of the younger age groups that I saw.
There's been an increase between ages 10 to 17. And in Washington State, between 2013 and 2017, 499 young people died by suicide. And for Native American youth, it's the leading cause of death. I also read that every 12 minutes, someone in the United States dies by suicide. And that's about 44,965 people a year. So this is a public health issue and also a world public health issue.
In terms of looking at the individual brushstrokes, if you will, and the individual experiences with that, Elsie, I know that you and Ace have both had experiences, and certainly you, Rachel, in terms of doing the work you do. Could you elaborate on your experiences with that?
About 6 years ago, June of 2013, my wonderful son had his last day of school, senior high, and he got off the bus and went into the woods and died by suicide. I was away from home at the moment when that happened, and it was such a shock. I mean, I had to drive home from Bellevue on a Friday, and each mile felt like an hour. And I can remember calling 911 and asking if I could use the carpool lane, even though it was just myself. And the operator said, "I can't give you permission to break the law." And I did anyway. I got to the carpool lane, and it still took me 45 minutes to get home. And when I was driving, I wondered why they didn't tell me to go to the hospital. No one had said he had died, that he had threatened, but I thought, okay, I hope they got him to the hospital. And I remember calling my youngest daughter, adult daughter, and asking her what was going on, and she was crying, and she said, "Mommy, just get here, just get here." And I turned the corner to the street where all the police cars were, and I saw my husband walking up the hill, and he shook his head no. And then I knew that our son was gone. A week later, we were supposed to send him off for a senior breakfast and to have the senior picture taken on the football stands, and then to do the dress rehearsal for senior graduation. And instead of doing that, we were holding his funeral and burial services.
And Ace, that's a situation you can associate with all too well.
Yeah. Our daughter was just a little bit before her 22nd birthday, 7 years ago. This last May, she took her own life. We had fought a long battle of 7 years without first knowing what was going on. Is it just adolescent changes, in her mood and so on? But over a period of time, it became pretty clear that she was fighting with some pretty serious mental issues. And so she had tried to take her life and was discovered by a Good Samaritan who actually found her and called 911, and they came and resurrected her literally because she was on the way to death. And she was pretty upset about the fact that she was found. Didn't even want to meet the person who saved her life until about 3 months later, and then she did. So we had a real serious battle of trying to keep her alive, networking with many professionals as we could, and never letting her out of our sight. And even when I would take her to work, pick her up from work, and but she had really determined she was going to take her own life, and so she fooled us and took a trip to Portland, and I got a call actually at midnight, literally 12 o'clock, from my daughter saying that she was in Portland and that she had injected heroin. And I was begging her to tell me where she was. I would come and get her, and she said, "No, Daddy, you can come and get me tomorrow morning. I'll meet you at the train station." And so, now looking back, there are things we might have done even to find her then, but we didn't. So I drove down the next day and finally got a call from the Multnomah County Coroner's office, said, "Your daughter's dead." I went over to see her, and I said, "Can I see her?" And they said, "No, this isn't CSI. Literally, this isn't CSI. You can't go back there." And I went, ah. So we didn't get to actually get her body transported back to Washington for about another 10 days. And it was very, even though we had been fighting and knew she was ill, the real shock of it is devastating, and it ripples on forever, really. So we lost her, and now we get a chance in this forum and other places to make a difference, to help other people not have to experience what we did and what she did.
We're going to talk about addressing some of those issues, but as parents who have been in this horrible spot, what do you wish other people that might be watching and encounter somebody in their life, their circle of neighbors, coworkers, etc., what would you tell them that you wish they'd recognize about the most sensitive, the most supportive way of dealing with someone who is going through now or in the future what both of you went through? Any things that you'd pass on?
I would say being present is probably the most important thing that a friend, neighbor, colleague, fellow student can do. There's just so much that goes on in the world, and we were so focused on his high school graduation that I carry a tremendous amount of guilt that I didn't see things that after the fact that might have been hints. One of the things he did was he asked me if I would take care of his dog. And I assumed he meant, since he was going off to college, that I would keep the dog so he wouldn't have to take the dog to college with him. And I wish I would have clarified, son, why are you asking me to do that? But I can beat myself up forever about the shoulda, woulda, couldas.
Right. Ace, any perspective that you'd share?
Yeah, I would say that first of all that you really can't fix anything. If someone comes up to you and says that their child or husband or wife or whomever is struggling with mental illness or depression, what have you, that you don't try to fix it or minimize it or, oh, it'll be okay. But I think present is really a good thing. And recognize that I like to say out of one of the scriptures that says, those of you who are strong right now bear the burdens of those who are weak, because your time is coming when they will bear your burdens. So just an idea of understanding and being there in a non-judgmental, present way.
And Rachel, you've been on this issue in this place yourself. What would you say to that? What is the best thing people can do to help rather than unintentionally harm, perhaps, people that are going through this struggle at that time?
Thank you. The work with like critical incident stress debriefing, that's something that can apply to both first responders and then people in the hospital environment who've received these young people into their emergency rooms. All the folks who've trying to help are impacted, and then being present to the family that's been affected. I think the thing that I see is trying to inject into all of that dynamic the personhood of each of these people. That mom and dad are people that they're not something that we can treat in the medical environment or in the first responder environment. They're people that we need to be people with.
You mentioned critical incident stress management. Any other particular points when you work with people that are very useful for them to know about, to utilize, to reflect on when they're dealing and trying to assist somebody in that case?
Well, the first thing is sort of knowing that you're talking to people who are in the midst of trauma. They're still having their trauma experience. They just got that news. And so when you're with a person in a trauma experience, they'll keep forgetting what they've just heard. And so just really gently and being patient and repeating baseline information and making sure that lots of people in that room hear that same information. And then also I think really doing whatever you can as a provider to make sure that they do have access to their loved one in that moment. And it hurts me to hear that he didn't have access to his daughter, because again, then okay, he can't go back there. Let's find a room where we can bring her, and so he can see her in that room. And we did that frequently in the hospital setting where I was a hospital chaplain. There are many times not sufficient dedicated space for those kinds of encounters. And so making sure that every patient unit, or the ER at least, has a place that we're going to say this is a dedicated space, or we're going to make it this in this instance, where we can bring these people together.
Speaking with the perspective of some years after the loss of your loved ones, is there information, guidance, clues that you wish you'd had access to at that time but didn't? And what would that be?
Well, I wish that, again, that things had slowed down, because things were so fast. It was getting to high school graduation, and we were doing scholarship applications. The day before Jamie died, I sat down at the coffee table and we were filling out scholarship applications. So I didn't have any awareness at that point that something was wrong. And then also, just the day before too, he had gotten his cap and gown. And for some reason, he did not want to put it on. I mean, his dad and I were like, oh, let's see what you look like. And he put it on maybe for all of 5 seconds and then took it off. And I wish I would have asked him, son, why are you feeling that way? But I thought maybe it was, the stress and the changes coming in his life with his friends moving on and himself moving on and things like that.
Well, I think, thanks for asking that question, that what I didn't know what I didn't know. And after she died and I started getting involved with National Alliance of Mental Illness and a lot of other organizations and programs, I started learning things that I had not heard about before, including really how you can network with support, because one of the things you find out when you go through a long period of someone fighting mental illness is exhaustive, and you can't do it on your own. It'll eat you up. And so knowing the resources and how to plug into them was something that I really didn't know. When she came out of the hospital the first time, Harborview, there was a whole wall full of brochures. Well, we're taking her out, going to the pharmacy, getting a bunch of drugs, and which brochure do I take?
Right.
So knowing the resources and being able to plug into those resources would really be very, very helpful. And then also knowing some things now that I've studied since then that I had not heard about that may have changed her life, maybe not, but we never got a chance to apply them. So there are some things about nutrition and epigenetics and genetic study that I had not heard about that might have made a difference in terms of, for example, when you go in and the doctor says, well, here, take this antidepressant. Well, you better be really careful with that, because the wrong antidepressant can, in fact, exacerbate your suicidal ideation. So you need to know what medicine and why, according to your own biochemistry. I didn't know any of that stuff at all.
So that might lead to the question then, and this is, I think, a two-sided question, and that is, when we're talking about availability of information, the legal, the medical, the educational communities, where they've done well and are making some advances, and where they've done poorly. And we might begin with the first case of that, and that is, where are those communities not providing what is needed? And I would say whoever would like to tackle that first.
Well, one of the things that the statistics say across the board, wherever we're looking at them, is that there's a real distinction between the level of rate of suicide in urban areas versus rural areas, and that the rural areas tend to have a higher incidence of suicide overall. And that's being attributed to the fact of the lack of resources for mental health care, the lack of referral resources that are close to people who don't have access to driving, who don't have the funds to be able to do that. Even now, I have people come to me asking for referrals for mental health, and I know that we don't have very much where they are, and they're not going to be able to drive down to Seattle.
Right.
And so I think it's a real need to identify how are counties and rural areas going to identify how they get access and make referrals. Do we need to go back to it's the doctor that goes on the road model? How do we do that? And there's some wonderful resources called Mental Health First Aid that can help families and others just kind of at least get some basic information of how to respond or intervene.
So, Rachel, when you talk about mental health first aid, what does that look like? Is there something people can access, or
there
what exactly is that?
There's actually something on the FEMA website that you can take online as a course that's called Mental Health First Aid. And then it generates a little certificate, and you sign up as a student and get your ID and you have your certificate. But it's a way of getting introduced, and also I think it's available through the American Red Cross as a mental health first aid. That's part of their training. And the idea of looking at this as a community response, it's almost like every community is being encouraged right now to get a disaster plan in place.
Right.
I would like to encourage each community to get a mental health care response in place, not just put it on the schools who have young people as their responsibility to do, not just put it on nursing homes as their responsibility to do, but we have resources in even the smallest communities that if we got on that pager or got on the phone, we could activate and have them respond.
Elsie, what are some needs or shortcomings that you've observed?
I think there's a reluctancy overall in any community to ask hard questions, and seeing someone being sad, you know, you might think that that's situational and temporary, but to be watchful to see if it's ongoing, and then to ask a hard question like, are you thinking about harming yourself? You know, those hard questions need to come up in any group.
Ace?
Well, I'll give you an example of the legal system. When Alicia was in a hospital in Portland, and she was there for 90 days, just before, she was in there involuntarily because she had tried to kill herself, and then she was in the hospital. But after 3 days, she had to go before a judge in handcuffs down to Multnomah County, the center at the jail. And the public defender and I were talking beforehand, and he said, even though your daughter has a portfolio this thick of mental illness, if she can convince the attorney at this moment that she, or the judge, that she is okay, they very well could release her. And Mr. Bulger, if you say that you'll take her, don't tell them you'll take her, because if you do, they'll say, okay, good, here you go, here's your daughter. But if you do take her, make sure that the doors of your car are locked from the inside and she can't have accidents, so she won't jump out of the car when you're on the freeway, something like that. And I thought, well, our daughter happened to be very compliant and said in the courtroom, Daddy, what do I do?
Yeah.
And I said, well, at least you do what they ask you to do. And so she stayed. But if she were not cooperative, because she was an adult, I really would have had nothing to say. I almost would have been an adversary. And so the legal system is really sort of absurd when somebody who is mentally ill then can speak on their own behalf, and the parents or guardians do not have a legal right to speak for them. That's an example of the legal system being broken. I could go on with other examples in the medical and educational, but maybe we can get that in a bit.
Okay. Having looked at those aspects that are not working very well, have you seen, and you mentioned one, Rachel, in terms of that first aid, are there examples that you've seen in any of those aspects or communities that have advanced and are something that, or is something that would be very good for people to know about?
At the University of Washington, there's an organization in the research area. It's called the Forefront Suicide Prevention, and they've been able to have 9 state laws passed, and they encourage training for mental health providers and school counselors and that to identify symptoms of suicide and what to do next after that if they do feel like there's a student is in danger.
And you've had direct experience with that as well, Ace.
Oh yeah, for sure. OSPI, Office of Superintendent of Public Instruction, is doing an amazing amount of work of reaching the schools to develop crisis plans, include suicide prevention. The state of Washington is integrating its healthcare so that behavioral, mental, and physical health will be addressed all at one time and not segmented and siloed. There have been some really wonderful approaches to that. One of the things that we found afterwards, after my daughter died, I went to the different providers and said, gee, would you guys be interested in the concept of talking to each other around the client, including the family? And one of the physicians said, no, my client's highly motivated to do that on her own. On their own. I said, well, my daughter wasn't. So what that has come to is that I found out after the fact that it's called wraparound, and you might have heard that, where you have all the different professionals in family and support network actually talking together around this person who needs help. It's a fantastic model because dealing with somebody who is ill is not a one-person job. It is a community job, a family job. So the wraparound thing is happening, and I'll be glad to share with you some of that later. It is a really wonderful advance in the medical system and in even the legal system.
And I think that needs to start too, right in that emergency room where the first person may be presented. That hospitals really need to look at, assess their interdisciplinary care. Do they have everyone in the room they need? Because it's not simply a medical issue, let's stop bleeding or pump a stomach. It's let's get a medical social worker in here to also be working with family on the costs and the care plan. And then we need a chaplain who can assess just the well-being overall holistically of how this family, do that family and the unit have what they need to be able to cope and move forward together, as well as the person in the bed.
What are some major misunderstandings that you think exist? And we've touched on that a little bit. What is something that you think you wish more people would recognize or have an orientation to in terms of this. Elsie, I know when you and I spoke, you had a couple of things that you wanted to bring up.
It always bothers me when I hear people say, or I see it written, that suicide is cowardly or suicide is selfish. That young person has felt like he or she is such a burden in life that they're doing the family and friends and neighbors a favor by removing themselves from the lives. So it's not an act of cowardice or an act of selfishness. It's being selfless, in fact, I see. I would also like to see the wording around suicide to be changed in all places in life. Like even when a celebrity dies by suicide, they'll say so and so committed suicide.
Right.
And that's an old term going back to suicide being seen as a crime. Again, I'd like to see what the focus should be on getting counseling and treatment and removing that stigma and shame and silence around suicide. We don't hesitate to go to the doctor for heart problems again, and we shouldn't hesitate on offering our children medical treatment and counseling.
Well, it's apparent that this is far too big an issue for a single program or even a series of programs. So in our next episode of Challenge 2.0, we're going to pick up where we left off and look at maybe some foundational aspects, the high levels of stress that our young people are experiencing, and perhaps what all of us can do about it. So thank you for joining us today, and we hope you'll tune in again next program.